Hello everyone, my name is Sérgio Branco and I'm here today presenting the paper entitled Remote Secure Monitoring Applications for Respiratory Ventilator Implementations. I would like to thank you all for being here today, and I would also like to thank all my co-authors for all the help they have provided in order to achieve this work. So, let's start. The Internet of Things is probably a term that many of you have come across in your daily basis. Um, it regards the fact that right now more devices are being connected to the internet. Probably right now, the number of devices connected to the internet surpasses the number of people using the internet. And since it's now easier and cheaper to have devices 24/7 connected to the internet, lots of novel applications are emerging. And of course, one field of study where those applications are becoming very, very interesting is in healthcare. And it's easy to understand why. We want to verify in real time if a patient is having any health issue. So if it's having a stroke or a seizure, we want to know that prior or in the exact moment that any of those problems is happening. However, in order to achieve the goal of real-time monitoring real-time patient monitoring, um, we have to produce health applications that are reliable, secure, and easy to access, especially for the medical personnel that's going to check the data or use the data or verify if something is wrong. In this work, we show how we have implemented a real-time, low-latency remote ventilator monitoring application. Uh, the work was developed using the internal ventilator created by CEiiA during the COVID-19 pandemic. We have used a communication protocol named Blackwing developed by me in around 2018-2019 that intends to provide a low overhead and an end-to-end communication tunnel for IoT devices. So, what is the architecture of an IoT health application? First, we have a consumer that has some kind of devices connected to it, and this device is able to collect data using sensors. The data is then sent to a microcontroller that pre-processes the data, checks if any acting is necessary, and communicates the data to a cloud-based system. In order to communicate this data, he has to use some kind of communication protocol. You have probably heard of HTTP or MQTT. In this case, we are using Blackwing. Then the cloud computer, of course, stores the data and probably allows anyone to access the data from a secure and well-established environment. So, um, why this work? First, during the COVID-19 pandemic, we heard the news about lack of ventilators and the impact that the fact that we don't have ventilators would have in to save lives. Therefore, CEiiA had created a ventilator to from scratch to address this problem. The ventilator worked properly and allowed to see patients' data, to make them breathe, and to help during the pandemic. However, the doctor, like in almost any ventilator that exists in the market, the doctor had to be inside the facility or the room to change or to see the patient's data. But as many of you may recall or may experience even, we heard a lot of painful stories of doctors and nurses that were wearing diapers or having their eyes bruised due to the protective equipment that they had to use. This was very painful, and they couldn't leave the room because taking off and dressing up again was all that protective equipment was very, very time consuming. So because of that, we have decided to pick up this ventilator that they had and to create a new one, this upscaling antenna that would allow doctors and nurses to act and to see the data of the patients in real time remotely. So the doctor or the nurse could be outside the room or even outside the hospital and check the patients. Due to the vital importance of this kind of application, because we want to act and to make decisions, we had to ensure that the data was viewed in real time and in a secure way, because this is a machine that's literally in life supporting someone. So as you can see here in the image, we have the display from the ventilator, and we have a tablet that's showing the remote application, and you can see that both of them have no visible delay on the data. That's the plots that you see, the white bar, you can see that is almost in the same place, so our eyes could not check the delay that was between the data collected by the ventilator and the data seen in the remote application. And this is very important because doctors have to make decisions, so they have to have this data as soon as possible. And all of this was possible thanks to the use of Blackwing and microservices. Here you can see the graphical interface that the ventilator has. Also is the same graphical interface for the remote application. The remote application is web-based. I didn't mention it before, but so as you can see here, you can check all the important parameters of that the patient has. So as the PEEP, the peak pressure, and the respiratory rate, for example, and the oxygen level. Also, you have three main plots: the pressure, the flow, and the volume. So we have a lot of data being collected. Also, you have the alarms. We have a lot of data, and the ventilator was collecting data in about 60 hertz. So it's very, very it's a very high rate of collecting data. However, since we are collecting data, we also want to collect some information regarding the patient, so we can use this data in the future to study, for example, what may cause the patient to heal better, or to heal faster, or to even, unfortunately, to die, or to have a more complicated situation. So it's important to collect also infos about the patient. So, for example, the height, the weight, the age, but also what the doctor is doing. So, what kind of ventilation mode is using, and what kind of parameters is set up for the ventilator, so that in the end we can create a database with this kind of information, because it's not only the data that we collect that's important, it's how we can relate it and tell a story about it. So because of the vital data collected and the importance of ensuring a low latency communication and a secure way to avoid anyone to collect this private data or changing it in some way, we had to ensure a low overhead and then end-to-end encryption between the host, this is the ventilator, and the server. So Blackwing achieves this through the use of asymmetric and symmetric encryption and its microservice architecture. So the encryption basically ensures that only the device and the server um, have access to the information and can share data because they have a secure tunnel that no one can listen to, or even if they listen to, they cannot in any way inject data or read the data that's been sent from one place to another. And the microservice ensure that you have an atomic reaction to the data, that's to the all upcoming data that is being sent by the ventilator, and you can choose the respective task that data is meant to be used on. So for example, we can create microservices for the plots that are very time consuming and processing and need a lot of processing, but we can use another ones for data that's not important to be checked in real time. So we can have this kind of two ways of dealing with the data according to its importance and to its periodicity. So as you can see here, we have been able to connect multiple we have been able to connect to multiple microservices. One is our default ventilator monitoring application, the one that you saw on the tablet, and the other one is a mediator, because the problem that we also then face is that a lot of other people want to use this data, not only us. So sometimes we have to have a way to provide this data to them. But either we have to create a lot of microservices and been sending all of that to all microservice, or maybe we only use microservices for the real important part, that is the real-time web monitoring application, and then we send it to a mediator that has more time and that's more complex, but that can put the data in lots of formats for other consumers to use it. So basically translate the data to another one. Sorry. So as you can see, we have used 5 different ventilators. This is the image on the top shows the main dashboard for the doctors to see. So they will see all the patients that are connected, and they will check and they will have access to the real-time data right on the dashboard. If they click on any of these beds, they will see this information, this dashboard then. So they will see the real time and the plotting for the patient. But here they have the main informations that here you can see is on your left. So because this is already very insightful information for many doctors. As you can see here, with only 5 ventilators, we could reach about 150 packets per second. So it's a lot to handle in such short notice. But the Blackwing protocol could handle it without any flinch. And as as you have seen before in the tablet, there was no visible delay for the human eye to be cared of. So for the conclusion of this work, we have presented then a remote secure monitoring application for a real respiratory device called the Tena. And lastly, we also, in order to maintain this device these device services available and with integrity of monitoring application, we also have created a mediator integration. so that other consumers can use this data. I would like to thank you all, and I will await any questions that you have. Thank you.